On January 20th, the first confirmed case of COVID-19 in South Korea was a 35-year-old Chinese woman.
The health ministry held a briefing live on television about 5 hours after confirming that a 35-year-old Chinese woman who entered the country the day before was diagnosed with the virus.
3 days later, the first Korean national, a 55-year-old man who worked in Wuhan and returned to South Korea for a checkup, was confirmed to be infected. Korea saw its spike in COVID-19 cases after an infected member went to a service at Shincheonji Church of Jesus located in Daegu on February 18th. The 61-year-old woman attended church despite experiencing a sore throat and a fever. The virus was spread to about 1,000 worshippers on the day she attended. By March 24th, the church had developed more than 5,000 COVID-19 related cases.
The Korean government always reacts fast. And not only in tracing infections, the first outbreak in South Korea was related to a church here in Daegu. And after the infection was confirmed, the Korean government was able to basically track down all the members. And this was, it's a lot of members in this church. So they were able to track down a lot of these members and get them tested. So I think that's the thing with Korea, is that they're very quick in their response to this, as well as other kinds of incidences.
The Korean government began taking precautious measures to travelers entering the country. They wanted to detect the virus before releasing people back to society and preventing a further spread. A real-time polymerase chain, also referred to as RT-PCR technology, was used as a testing method, showing results in 6 hours and detecting whether the patient had contracted the virus or not.
Whatever we complain about Korea, we have to admit that the good thing was that the government, the authorities right away recognized that there was a problem at hand, and they right away started reacting accordingly and acting in a crisis mode. So all the prevention measures, all the quarantine, testing was implemented pretty much from day one. You could say that because Korea is right next to China, they had the intelligence, like how bad it could get. But then on the other hand, so did the US. And they just decided to ignore the whole situation, whereas Korea did not ignore the situation and actually reacted to it. It was pretty much also, it was not only the government and the authorities, but I guess the society also accepted that this is a crisis mode. We have to mobilize ourselves. Things are going to be a bit tough, but if we don't work together, it's going to turn really, really bad, or worse than it is right now, very quickly.
Schools of all levels, kindergarten to high school, were all postponed for the first 5 weeks of the school year. Luckily, for high schoolers, the national college entrance exams were pulled off until further notice. The ministry opened emergency childcare programs available during the weekdays for employed parents. As for college students, their spring semester began online using video chat software and the KakaoTalk Messenger app. Students and professors were adapting to their new normal. Cram schools were banned to continue classes and would face a 3 million won fine if violated. The government would be able to file a compensation lawsuit against the cram schools if they caused more contamination. Flower farms were struggling financially since ceremonies and events were cancelled. A 30 billion won business rehabilitation was made available for farmers to apply and support them during this unexpected market downfall. Along with financial support, the Agriculture Ministry and other organizations bought 2.7 million flowers to show their appreciation to these local shops.
From the government side, there are like subsidiary support payouts offered to not startups per se, but SMEs, like small, medium businesses, usually mom and pop shops that there was a moment when people couldn't go to restaurants and coffee shops, they had less clientele and they struggled a little bit. I don't think it was much when it comes to money-wise. There are talks among the startup support government institutions to use the funding that they cannot use for offline conferences to use to support the ecosystem, but that has not really been defined how it's going to be.
The most severely damaged people in Korea are obviously those who have their own business. And if that is small business, that can be really, really critical. And some of my friends who were running small bars or pubs, some of them actually quitted their stores.
Companies allowed some of their employees to work from home with flexible hours. Amongst the people who worked from home were pregnant women, parents with young children, and those with underlying diseases. Those who continued working from their work were following the strict new guidelines. Workers would go through a routine of being checked by a thermal camera and then have their temperature checked by security guards. If offices got new COVID-19 cases, the building would be closed for disinfections.
With the rapidly rising number of confirmed cases of novel coronavirus 19 in the country has upgraded its level of alert level to its highest. And President Moon Jae-in also ordered an establishment of a stronger response system to the people.
The coronavirus alert levels rose to a level 3, avoid non-essential travel after reaching a high number of cases. It was the first time in 11 years where South Korea alerted a level 3 warning. The last time was during the 2009 swine flu pandemic. Temperature screening became mandatory to all passengers traveling from South Korea to the US starting March 3rd. Passengers with high temperatures would not board and their luggage would be removed from the plane.
South Korea's aggressive testing has inspired many countries in their fight against COVID-19. And the country may offer yet another lesson for the world in its efforts to contain imported cases using a highly systematic and tech-savvy monitoring system.
Korea created a self-diagnosis app for mobile device. It became mandatory to users to self-diagnose every day starting February 12. The app would not only diagnose the patient, but health workers were able to retrace where an infected person has been by using their GPS history and confirm by checking credit cards and security cameras. The app shared also details on what buses they boarded, if they wore a mask, and who was around them. Users will also have to alert the government when they got out of isolation and can face a 2.5 million won fine.
Nearly 20,000 people are being tested every day here in South Korea. Actually, I think the strategy that was the most effective here in Korea was the sharing of information. The government delivers information for every person that's been infected. So basically, they trace the movement. So everyone is able to tell where an infected person has gone, and then from there be able to take some action.
4 South Korean companies were able to create testing kits in 3 weeks. The kits were able to determine whether a patient had the virus by detecting if they had a certain gene. The gene was visible when mixing their body fluid sample with the chemical solution. The sample was taken by swabbing the patient's throat and nose.
I would say the masks, the self-quarantines and things like that, these are more like guidelines that are suggested by the government, and the people, the citizens, can choose to go with them or not. Like, yes, the government will try to hard to implement them, but at the end of the day, it's the society's decision whether they will go on with it. From the government side, I think the mass testing was a really good move. The mobilization of all the medical and emergency forces.
The company produced 100,000 to 500,000 testing kits each week, and the Central Incidence Management System for Novel Coronavirus, also known as IMS, planned to have 10,000 testing kits available each day for diagnostic testing.
South Korea tested more than 66,000 people within just 1 week of its first case of community transmission. How did South Korea test so many people so quickly? But we didn't even test a fraction of that number.
South Korea was known for testing more people than any other countries and for treating their patients immediately. They conducted 300,000 COVID-19 tests, which were 40 times more than the US. They had 600 available testing centers around the country, and testing resources were free to the public because of Korean insurance. Tests would take less than 10 minutes, which included a questionnaire, temperature checks, and swabbing. People were able to get tested through phone booths and drive-thrus.
South Korean President Moon Jae-in apologized at the weekly cabinet meeting on Tuesday for the government's failure to supply the masks quickly and sufficiently to the public.
마스크를 신속하고 충분히 공급하지 못해 불편을 끼치고 있는 점에 대해 국민들께 매우 송구스럽게 생각합니다. 대구 경북의 위기는 최고조에 달했고 국가 전체가 감염병과의 전쟁에 돌입했습니다.
The mask shortage had the Ministry of Food and Drug Safety cut down on the exports to less than 10% of production. And more than half of the production would be supplied to the government, to which 90% would be supplied in the country. 2.4 million face masks were supplied to 24,000 pharmacies, where customers were limited to buy only 5 masks. To prevent the spread of the virus, South Korean authorities started an aggressive cleaning campaign by disinfecting public buildings, subways, buses, and trains. As 17 infected patients were said to have used the Seoul subway system, Seoul Metro has reassured subway passengers that trains were COVID-19 free. They also added that stations have also been wiped down after being notified by the Korea Centers of Disease Control and Prevention of patients' movements. Korean officials were able to handle the pandemic well after experiencing the 2015 Middle East Respiratory Syndrome outbreak, also referred to as MERS. Doctors and nurses learn new procedures on how to prevent infection, keeping track of who comes to contact with an infected patient, and sharing detailed information. Korean health organizations were able to minimize the number of cases by accommodating for anyone to get tested. They stressed the importance of getting everyone checked if they felt just a little ill to keep everyone safe. The government protocol on testing centers, mask distribution, and safe distancing helped to ensure the safety of people.
It was really good steps, but those steps were backed up by the fact that Korea, before the whole pandemic even started, or before even the first cases of the virus appeared, already had a very efficient, very well working healthcare system. So just making sure switching it all into the crisis mode was much easier, much more smoother than in countries where such healthcare measures did not exist to begin with.
In the rapidly evolving public health emergency, the South Korean government says any foreign national who's recently been to Wuhan, China, or the surrounding region will be banned from coming into South Korea starting Tuesday, the 4th.
South Korean border control is protecting its borders by not allowing foreigners who recently traveled to Hubei in the past 14 days to enter the country.
Unfortunately, every industry has been really sorely affected by this virus. However, of course, since we are directly tied with tourism, and that means that people coming, that normally come to Korea can't come in. And if they are coming here, there is a 14-day quarantine. So a lot of people are choosing not to come. So we have had very few customers for almost 3 months.
Consultation centers spread out to various locations have increased their staff in efforts to reduce the wait time on calls for those who want to be more informed on COVID-19. The government is planning to have more available beds at hospital and disease control institutions in efforts to be prepared for a possible increase in potential cases.
I already knew that Korea has a very good, one of the best healthcare systems in the world, and I knew that they will be able to tackle anything that's thrown their way, which makes me really, despite that I complain about having to pay a lot for the healthcare insurance, at least I get my money's worth, and I see that my money's worth coming back to me in situations like this. I also knew that the society is very self-disciplined and that they have a very collective way of thinking. So I knew that they will mobilize themselves to tackle whatever curveball is thrown their way.
It is safe to say that Korea has been doing a great job in accommodating people when it comes to being able to get tested to keep others safe. The Korean government also was very proactive by creating testing centers, distributing masks, and keeping people at safe distances from one another. How did Korean citizens deal with the outbreak? Next time, we find out.